My name is Kathleen Driscoll. For my speech today, I wish for my classmates and the people watching this video to understand the difference between talking to an adult about their health care and how to properly word the discussion, versus how to discuss the health care of a child with an adult and how that discussion should be properly worded as well. When you're sick and your doctor sits down with you to talk with you about what you're ill with, how do you wish for them to be? Are you a person who prefers conversations to be blunt, to the point, and straightforward, or do you wish for it to go in a much more mild-mannered, laid-back, and calmer tone? What about when it is your child whose health care is being discussed? Do you wish for it to be handled in that same abrupt, harsh, and to-the-point manner that your health care would be handled in? Or should it go in a much more mild-mannered, calm tone because it is a child? Healthcare, be that of a child or an adult, is one of the most important things we can do in our lives to ensure that our lives are long, prosperous, and most importantly, free from illness and disease. Discussing healthcare, though, is not always an easy thing to do. There are many different aspects to healthcare, and one of those aspects is the discussion of the healthcare, be it with that of an adult about an adult's healthcare, or with an adult about the healthcare of a child. How the discussion should be handled varies from person to person and depends greatly on the people involved and who the focal point of the conversation is, be it an adult or a child. When I was a small child, I was sick with an incredibly infectious disease, and my parents were informed in a very ill-mannered and harsh way about my prognosis and diagnosis that because I was so small, my illness was so severe that I more than likely was not going to make it. Imagine the shock and fear that my parents must have felt at having such news delivered in such a harsh and mild manner. They most certainly were not ready for that type of diagnosis and were not expecting it to be handled and delivered in such a way. The delivery of that conversation could and should have gone much differently. As adults, we expect our doctors at some points to be straightforward and blunt with us about our health care, but we also at times may expect it to go in a much more mild-mannered and calm tone. And when discussing a child's health care, most adults, because it is the child and it is someone that they have raised and brought into this world and are caring for, prefer that the conversation go in a much different way. Today, I want to discuss with you some of the different aspects about healthcare and how they vary from an adult to a child and how those conversations should be handled. First, we need to discuss how the healthcare of an adult is different from that of a child. Understanding the differences will help you understand why they need to be spoken out in different ways and handled in different manners as well. As adults, our immune systems are far more advanced than a child. We tend to handle things much more easily, like the common cold or even the flu, in a different way than children would. Because of that, medications are prescribed differently. There are stronger doses, and how they are treated are handled in a different way. Adults also require different testings than children do. Because children's immune systems and their bodies have not advanced to the points that an adult do, during most of their visits, vital signs are not checked. But when an adult goes in, our heart rates, our blood pressure, and our respirations are all checked. Doctors need to remember that the bodies of a child and an adult are different. When discussing with an adult, they need to remember to speak up and not to minimize the fears or concerns of the patient. A patient may be worried if their blood pressure is off by 1 or 2 points than it was the day before, or they may be feeling anxiety because they're at the doctor's office, and as such, their heart rate is higher. Doctors and patients both need to take this into effect, and when discussing it, need to keep in mind that there are different controlling environment issues that can affect the way a patient will present itself during a checkup. Adults are also checked for things that children are not. Diseases and tests that we have run for our illnesses are greatly different than that of what a child will face. Adults also process information about themselves differently. They have far more advanced knowledge than a child does, and they may already have knowledge about things like their health care, such as their blood pressures and their heart rates and their respirations and what is expected. As children, they may not have that kind of knowledge about their child. Because the child's body has not finished developing, there are no set rates and no set ranges. A doctor needs to make sure when discussing healthcare that some adults are health literate. Not everyone has gone to medical school for as long as a doctor has, and overloading them with medical jargon is only going to make the visit much more confusing and the conversation much more difficult to have. A doctor also needs to keep in mind such barriers as race, religion, and that some people may not have English as a first language. In some cases, pamphlets may be needed, or a translator may be needed in order to ensure that healthcare is being discussed properly. Just because an adult may be health illiterate does not mean that they are incapable of processing the information that has been delivered. Continue to ask if there are questions. If they have questions, do they need something explained? Are they not processing something? Make sure to take the time and be patient with your patient. Use simpler terms, but not so simple that you cause your patient to feel stupid in your presence. Again, not everyone has gone to medical school. Not everyone has gone to nursing school. Some people only get their health information when they go to a doctor. Most adults have a basic understanding of simple medical terms, but going too far will cause your patient to feel overwhelmed. Now that we understand a bit about the healthcare of adults, let's discuss how caring for a child is different. Like we mentioned earlier, a child's immune system and their bodies have not developed like an adult's have. They are constantly growing and changing and developing. Their bodies have not reached the final point or their final stages, and as such, a doctor needs to remember that parents are going to have constant questions like, does my child weigh enough? Is my child eating enough? Is my child sleeping enough? Making light of these questions is going to make your adult patient feel stupid and feel like their concerns are not important. You cannot do that when discussing the health care of a child. Children also typically tend to have higher bodily functions, like their heart rates, their blood pressures, and their respirations. Because of that, they are not checked. Children also require different medication dosings. In most cases, their doses are lower, and they also have their own category of medications. You cannot give a child the same medications you would an adult. As children develop and grow, their bodies will grow and develop at different rates as well. Ensure that parents know that just because their child is not as tall as Timmy next door does not mean that there is something wrong with their children. It is simply a fact that everybody develops at a different rate. If your patient has questions or concerns, though, do not minimize those questions and concerns. Listen to them, be patient with them, and take the time to explain in a manner that they will understand what is going on. Now that we have covered a bit about the health care of an adult and a child, let's discuss how an adult's health care is different than that of a child. Most adults want doctors to be straightforward. They don't want the discussion to be danced around. They don't want it to be long and drawn out. Most adults, when they go in, want to the point and to get it done and over with. Most of us want to know the answers immediately, and as such get frustrated when doctors take too long to deliver a diagnosis. At the same time, adults don't want to be made feel stupid about their health care either. Most of us did not attend school, and as such, they do not have the same abilities to understand more long, drawn-out terms like a doctor would. Doctors need to make sure that they are taking the time to keep their patient in mind. When it comes to children, adults wish for things to be handled in a slightly different way. Most adults will always put their children first when it comes to their care. They want a straightforward answer about what is wrong with their child, but at the same time, they do not want the delivery of the bad news or grave news to come out in a harsh or lacking tact. They want doctors to be mindful of the fact that that is their child, a being they have created and have brought into this world and are caring for and raising to be bright young adults. Crashing their hopes and dreams by delivering news about their illness in a very harsh and strict manner is only going to put your patient off. Adults want to be informed about their child's health care and do not want to be made to feel stupid about asking the questions we have covered earlier. Patients are more likely to worry about their child's health than they are about their own, and will pay closer attention when discussing the health care of their child than when discussing the health care of their own selves. Adults tend to graze over and brush off what is wrong with themselves, but when it comes to their child, they are going to be more alert and much more involved in the conversation. Adults shouldn't be afraid to include others in the conversations about healthcare either, whether it be their own healthcare or the healthcare of a child. As a child gets older and becomes a preteen or a teen, parents need to make sure that children are included in the conversation. Not preparing them will only make the conversation be much more difficult for them when it comes time for them to start making their own medical decisions as they become adults. Discussing the healthcare of an adult with an adult is vastly different, as we have covered. there is so much that can be discussed and so much that can be covered that trying to cover everything in this speech isn't possible. But touching on the few points that I have will have hopefully made it easier for you to understand how to begin the conversation about your own healthcare versus how to begin and have the conversation about your child.